everyone, it's Hayley. I'm just coming on to do a quick update. I'm going to make it quick, I promise, regarding my CML diagnosis, chronic myeloid leukemia. You'll probably remember from my two previous videos, I was diagnosed. It was a shock because I was diagnosed via blood tests that I had prior to surgery I was booked in for. The last video I did, I think I was only a couple of weeks into taking the medication, so it's been a really long time, and obviously lots of stuff has happened since then, so lots to update you on, but I'm going to whiz through it, I promise. I'm coming up to 6 months now since I started the medication, and everything seems to be going good so far. I'm on imatinib, 400 milligrams, which I take once a day. It's the standard drug that they put most people on to begin with. Some people do really well on it, some people have to be moved on to something else, but they usually try imatinib first. So I'm on that drug. I do have side effects, small price to pay, I would say, for having the illness under control. They are, some of the side effects are quite severe and impacts me on a day-to-day basis, but I still say it's a small price to pay. So the side effects are fatigue. I get muscle and bone pain and aches. I find that my skin has gotten really, really dry, especially on my hands, really, really bad on my hands. My hair isn't falling out lots and lots, so it's noticeable, but it is falling out. I'm still waiting on results from my thyroid because my consultant has said that it's an uncommon side effect of the drugs that I'm on. So it could be a side effect directly, but it also could be that my drugs are affecting my thyroid, and he said if your thyroid is affected, then that would definitely cause you to lose some hair. So I'm still waiting to hear on my thyroid results. What other side effects do I get? I get really breathless really quickly. I don't have the same stamina, so I get really worn out if I walk around a lot. I feel it for days afterwards. I feel like I've done a huge workout and I just ache from head to toe. So I can't do the same things that I used to do. Carrying my 1-year-old up the stairs is okay, but carrying my almost 4-year-old up the stairs is hard work, and I can't really do it because it really causes discomfort and pain. Walking upstairs, I tend to have to get lifts. I can walk down the stairs okay, no problem, but walking up the stairs is really tricky. I can handle a flight of stairs in my own home, but if I'm out and about, I tend to get the lift. Yeah, and just general, any kind of exertion really takes its toll on me, so I have to take things a lot slower. I'm still learning what my limitations are now and what is the new normal for me. Things like making dinner, peeling potatoes, stirring big heavy pots of stew or curry makes my wrists and my arms ache. It's all little things that you kind of don't really think of, or you don't think would be such an impact, but they really, really are. So things like that are my side effects. I'm super forgetful and can't really concentrate much at the moment, but I think that is more of a stress reaction than a side effect of the medication. So hopefully that's something that will subside as time goes on. I will make a separate video about how I'm coping sort of mentally and emotionally with everything. There's been a whole cascade of sort of traumatic experiences that happened last year, so I will make a video on all of that. and kind of fill you all in on everything that happened last year and sort of treatments going forward on how to cope with that. Another side effect, I've always suffered from migraines since I was about 6 or 7 years old, but as I've gotten older they become less frequent, less intense. I tend to get sort of 1 or 2 a year. That's it now. Since I was about 25, maybe 24, 25, they really kind of shrunk down to sort of 1 or 2 a year. And then since I started taking the drugs, the migraines, I was getting them daily, not with any pain. I've always had the migraines with auras, all the visual disturbances, and then I would have an excruciating headache for the remainder of the day. Now I'm getting just the visual disturbance, but with no pain afterwards, or rarely any pain. So I'm now also taking amitriptyline, which I take every night, and that has helped my migraines. I occasionally get them, but I'm not getting them every day like I was before I took the amitriptyline, so that is working for that. So then on to how my body is doing with the drugs. So side effects aside, how the CML is under control. My sort of basic superficial blood results are good. My white blood cell count, my red blood cell count, neutrophils, which are a type of white blood cell to do with fighting infection, and my platelets, all of those are good. I'm slightly anemic, but he's not wanting to put me on iron tablets yet, so I'm not at a level that's a concern at the moment. So all of those bloods are doing really well, and they have been since 2 weeks after taking the drugs, so those are brilliant. Once you get those under control, they then look deeper, a deeper sort of more in-depth blood test called a PCR, and that they're measuring the BCR-ABL gene, which causes the leukemia. So what they're looking for is how much of that is in your blood. I've had one at diagnosis, and I've had one since I started on the medication. The one when I first got diagnosed was, I don't know how it's over 100, but it is. It was 182% or 185%, something around there. And then 3 months later, after taking the imatinib, it went down to 32%. So I wanted it to be under 10%, but my consultant was so happy with 32%. He said it's right where I need it to be. He was just looking for a reduction, so he was more than happy. I have to have my 6-month PCR blood test taken on Friday. Today's Tuesday, so this coming Friday, and then I'll get the results at the end of April when I go in for my monthly consultation with my consultant. So leukemia wise, everything is going well so far. My consultant is really happy with the way things are going on these drugs. I've been really anxious about having to have another bone marrow biopsy. If you watched my last video, which cut off before the end, you'll know that I didn't do too well with the bone marrow biopsy, and he's been talking about having another one. He did say at my last appointment that if my PCR comes back with really good results this time, then I may be able to twist his arm to not have to have another bone marrow biopsy. So I'm really rooting for really great results with this PCR so that I can avoid having a bone marrow biopsy. If I have to, then I have to. He's already talked about giving me something, not to sedate me so I'm sort of out of it, but just to calm me down. He's talked about doing something like that before I have the next one, just so I'm not so stressed. So if I have to have it done, then I have to have it done. It's not a problem. But hopefully PCR results will be great and I won't have to. So fingers crossed. So yeah, everything, I'm still learning about it. I still have questions every time I go to see him. I've got new questions, and I'm most certainly not an expert. But I am understanding it a lot more. I'm feeling less fragile. I'm feeling more optimistic, cautiously optimistic. And yeah, everything is going okay so far. So I will try and make these more regular, but I don't want to update every 5 minutes. So I'll probably update when I get my next PCR results, and then unless there's anything like any special tests or anything else to update you on, I'll probably just update you every time I have a PCR, which is every 3 months. So CML wise, that's probably the most you'll hear from me is every 3 months, unless there's something going on in between, any other extra appointments or change of medication or anything like that, then I'll fill you in. So they'll be regular, but they won't be all the time. But yeah, everything is going along nicely so far. So I'm really thankful for that, and I'm thankful for these drugs because they're amazing. So yeah, that's it from me. And any questions, please just send me a message. I'm more than happy to answer any questions of anyone who might be newly diagnosed, or anyone who just wants to connect about this disease, or know someone who has it and wants to ask questions or whatever. I'm open to answering anything. And yeah, that's it from me. So I'll talk to you again soon.